Hello. I'm just waiting for a few more people to join us. But tonight we're going to be discussing women's health. I put a post out a few days ago asking everyone if we did this series, how could we, what are some topics or subject matter that we could discuss? And I got several different topics from womb care to hormonal balancing, menopause, PCOS, fibroids, ovarian cysts, uterine cancer, yeast infections, infertility, vaginal discharge, also low sex drive. So I got quite a bit of information and feedback from quite a few of you ladies, and thank you very much for giving me these topics to kind of go over and an opportunity to share with you. Hi Marcia, hi Diane, hi Angela. So tonight, because we have so many topics that I truly want to cover everything that's on the list. So because we have so many topics, I had to break it down into segments. So tonight we'll focus on the basics and some things that we can do to keep our womb healthy. We'll talk a little bit about yeast and talk a little bit about bacteria, vaginosis, different things that women deal with, and even our teenage girls deal with these things. And it's not always about having intercourse, but the most important process that we need to know is hygiene and keeping our diets healthy enough so that our body can function properly. So I want to start off talking about like the endocrine system. Your endocrine system has all of your glands. That's your pituitary gland, your thyroid, your parathyroid, your thymus, the adrenals. And in women, of course, our gland our sexual gland is our ovaries. Okay. Now the pituitary gland, which kind of rests in the skull here, in the head here, right below the brain, that's the master gland, and it controls the entire endocrine system. So these glands, all of them secrete a substance, known as a hormone, and those hormones go directly into the bloodstream to help the body function on so many different levels. Now, in women, our ovaries produce estrogen, which is another hormone that affects, us differently. And it also causes us to have different changes within our body, of course, on a monthly basis as well. Now, the estrogen affects our menstrual cycle, and the estrogen also affects our reproductive abilities as well. Now, of course, we all know that the ovaries contain, egg cells, which, lead to the, fertility, once a month, and we all know this part of the story, an egg is released, it's ripened and it's released, and it goes from the ovary into the fallopian tube, where it waits to be fertilized. If it's fertilized, then it goes back down into the uterus and attaches itself, to the wall, the uterine wall. If it's not fertilized, of course, the mucous membrane lining that's within the uterus releases, it breaks down into a fluid, and it releases, every month. Now, after a woman gets her menstrual cycle, the menstrual cycle begins 14 days after ovulation. So you can always calculate when you're ovulating based on when your cycle comes on. So you can always say after, ovulation 14 days later, that's when your monthly cycle should come on. Now that's how a normal process should go. And because of certain factors that affect our bodies, we don't always, most women don't get their cycle on a regular basis. Sometimes their bodies are producing more estrogen than what's actually needed. And those hormones over time can cause different, disorders within the body that affect different areas of the body as well. A few care tips that I wanted to sort of focus on tonight is being mindful of hygiene. And the vagina itself cleanses itself. We should never ever insert any types of wipes or cleansers or sprays or powders or anything on the inside that could actually cause potential harm, and remove certain bacteria that your body actually needs to stay healthy on a regular basis. So stay away from certain soaps, any scented cleansers, things that will cause your pH to be off. You want to avoid using vaginal deodorants. I know now they have, in the stores, like an actual deodorant spray that you could use, and that's not healthy for us at all. And avoid douching. A long time ago, my gynecologist told me that, it's okay to do that, to use a dish. And, it really isn't, because it actually washes away, the good bacteria that actually keeps your, body healthy. And that throws your pH balance off as well. Another issue that a bunch of ladies just probably sometimes overlook is the laundry detergent that you're using when you're washing your undergarments. You should never use any like harsh abrasives or scented fragrances, because that can all cause disorder within your pH. And when your pH is off, it causes things like yeast and bacteria to develop. And when I'm referring to pH, and I know I've said that quite a bit, but your pH deals with the measure of acidity that you have, or alkalinity that's in the body. So it's the way that it's measured, it's on a scale of 1 to 14. 0 through 6 is like the more acidic. 7 is considered neutral. 8 to 14 is alkaline. And the higher you go, 14 being the highest level of alkalinity, 0 being the most acidic. But for a healthy vagina, your pH level needs to be between 3.5 to about 5. And, yes, that, some would say, oh, that's sort of acidic, but that's the level of acidity that a healthy vagina would function at. So that's going to be around 3.5 to a 4.5. And there's also pH test strips that you can actually use. You can buy them at like a local drugstore. I've even seen them like in Walmart, places like that, but they're actual pH strips where you can test your your actual pH. Now, there's certain ways that your body can tell you if your pH is off or if your pH is unbalanced. One of the top 2 ways in women, the first one is going to be an odor. So if there's like a foul or a fishy type smell, that's one indication, that your pH is off. Another one is an unusual discharge. Naturally, women, have a discharge, but when it turns colors like an unusual white color or a gray color or a greenish discharge, those are 2 factors that could indicate that, there's something off and there's a growth in the body that needs to be dealt with. Vaginal itching. So itching can take place when the pH is off. Also burning when you urinate. And I know some of these sound like they're associated with STDs, and some of them are. Actually all of these factors are sort of associated to STDs, but in all actuality, yeast and bacteria vaginosis, those are not really considered STDs. Now, of course, 3 diseases are typically associated with a unhealthy pH, and that's going to be the yeast infection, bacteria vaginosis, as well as trichomonas. However, the thing with trichomonas is that it's actually considered an STD that's actually transferred back and forth, but it's supposedly the most common, easiest treated STD that there is. Now, when going to the doctor, oftentimes they'll put you on antibiotics, for, trying to get rid of bacteria or the yeast. And what, kind of frustrates me when going to Western doctors, they'll put you on the antibiotics knowing that antibiotics can cause an overgrowth of candida. So that leads to, you getting a yeast infection. So what they'll do is give you the antibiotics and then turn around and give you something like diflucan, which is, a type of drug that treats yeast infections. And it's just, one simple pill that you take. Now, another reason ladies can get, yeast infections is if you're diabetic. And a lot of people don't talk about this. If your diabetes is, if it's controlled, typically you won't have any issues. But if your diabetes is off the charts, uncontrolled, you don't have it under wraps, that can cause a great amount of candida to grow as well. Also, having a weak immune system. A weak immune system will definitely, cause, overgrowth in the body. High sugar diets. Eating a lot of sugars and carbs. One thing about candida is that it loves sugar. So if you eat a lot of sugars and you eat a lot of carbs, that can cause overgrowth in your vagina as well. A lack of sleep can cause candida overgrowth, as well as hormonal imbalances. So if you're experiencing any of these types of issues, and you know that you've been on antibiotics, you have diabetes and you don't have it controlled, or your immune system is weak, you're eating a high, carb diet, a lot of sugars, lack of sleep, stress can also cause it as well. Hormonal imbalance, all of those factors can lead to yeast infection. Now, the other issue that can take place when your pH is off is bacteria vaginosis, which is a bacterial infection. And, as I said earlier, all of us have bacteria. And there's two types of bacteria that our body actually, maintains to keep a certain amount of health and to keep our pH in balance and to keep our, acidity between that 3.4 and 4.5 level. And once there's too much of that bacteria being created, the two types of bacteria that's used to help, keep us healthy kind of gets thrown off as well, and it causes a lot of bacteria to grow, and that's where you get the unusual discharges, the foul odors, the itching and the burning. Hi, Sophia. One of the most important things in getting the easiest way of getting your alkalinity or getting your pH in check is by the foods that you're eating. I talked about staying away from the sugars and staying away from the carbs, and to offset those things, start eating more fresh fruits, eating green leafy vegetables. An alkaline diet will help your pH balance itself back into the right motion. Now, another thing to avoid is white flour. So if you're, eating the foods that you use the white flours or the white breads, things of that nature, that can cause overgrowth to take place. And also anything that has to be fermented with yeast, for example, alcoholic beverages, those also affect, your pH. Dairy products. Now, I know a lot of people will eat yogurt if they have a yeast infection, but, there's other ways to get the probiotics that, yogurt can actually give you if you're someone who's vegan or someone who doesn't choose to do dairy. I don't recommend dairy products at all because, you just never know what can cause the extra growth. But there's other ways to get the benefits of what yogurt can do for you in the process. So typically, if you, come into one of these types of issues, the yeast infections, the bacterial vaginosis, those can be treated easily at home. Now, if it is trichomonas, that, from my understanding, it can be treated at home using herbal remedies and different methods of that sort. And I'm going to talk about some things that you can actually do to treat. But with that one, I would still go get checked out from a doctor because it is considered a sexually transmitted disease. The first thing is getting probiotics in your system. And there's different types of probiotics that can do the same thing, basically. So kombucha does have to be fermented but I'm not sure if you use yeast in it, if it has yeast in it, you should, tend to stay away from that if you are suffering from those types of issues, the candida or the bacterial vaginosis. So probiotics is one of the first steps in your treatment. Eating antifungal foods like garlic, rosemary, thyme, cloves, getting those things in your body that are going to help fight the bacteria and fight the fungus that's actually growing. And with garlic, you can either get the fresh the bulbs of garlic or those small cloves, juice them, or you can purchase the aged garlic that's in capsules, and that will do the same thing for you. There's the Kyolic aged garlic. And that's going to be Formula 100, and I'm going to show you guys these in just a moment as well. The Candida Cleanse, which is also by the company that's called Kyolic, the Formula 102. Those two supplements will really, really help with yeast infections and the bacterial vaginosis as well, and it also helps to rebalance your body's pH. About 2 or 3 weeks ago, I did a video on the hydrogen peroxide, the 35% food grade. That is a winner, a very big winner when it comes to helping your body reset itself and get back on track. We already know that oxygen provides a lot of healing for the body and healing towards, in the tissues of the body as well. But of course, you have to dilute it. You can't just take or use the 35%. Straight, because it can, really burn you and cause great harm. Another step in treating this is using tea tree oil, and that's an essential oil. And because it's an essential oil, you have to be mindful that if you're going to use tea tree oil, you have to dilute it with coconut oil. And from the way that I was looking at using the tea tree oil, one way that you can use it definitely is by soaking a tampon. And I know I just said don't insert anything, inside the vagina, but this is one of those exceptions where if you're treating this, you're going to have to put something in the area to actually treat the situation. But soaking a tampon in the oils and then using it and, changing it out like every 35 minutes to an hour from what I was reading. Boric acid capsules, you can either use them as a capsule or you can use them as a suppository. So those are ways that you can actually help your body. And if you are suffering from one of these types of issues and you are trying to get healed, one of the best things to do is wear cotton underwear because it does help. And then as far as the supplements, I'm gonna go ahead and show those to you now so that you guys can see what they are. Okay, so this is the, I'm trying to zoom in for you. Okay, here we go. So this is the Kyolic aged garlic extract. Now this has the vitamin C in it. It has the astragalus. It has mushrooms and a few other organic, natural foods and things that will help you. So again, we talked about your body, having a low immune system, and that's how that candida can begin to grow within the body. You can use whatever probiotic you'd like. This is just an example. I've used this one before. I know Patrick uses this. He's used this in the past. But if you want to get one that has, more active strands in it, you can do that. But the PB8 probiotic is really good. This one here has 14 billion in it. And it's really good if you're treating any type of bacterial vaginosis, and it basically just keeps the whole GI system healthy as well, not just the vagina. And this one here is the Kyolic Formula 102, and this is the Candida Cleanse. And it also aids with digestion as well. But both of the Kyolic products have the aged garlic in it, and this is what you really, really need to help get your pH, back in check when you're fighting, these types of issues. Now, as far as the herbs that you would be using on this particular program, now this would be, it would take about 14 days to treat these particular issues and the herbs that you're going to use to treat these issues, the yeast and the bacterial vaginosis. The first one is the Podiarco, and that is an antifungal, and it's very, very strong. And cloves, both of them are going to be your antifungals. You definitely want to include those if you struggle in either of, with either of these avenues. Now, calendula deals with overgrown yeast. So you want to include the calendula as well, because that will help, the candida situation. Taking the calendula with the candida cleanse, the aged garlic candida cleanse will really, really boost that antifungal process as well. Now, we use echinacea because it's an alternative plant. So what it does, it actually begins to reduce the risk of reoccurrence. It will stop the candida from coming back. It'll stop the bacterial vaginosis from coming back. And it's not that you'd have to take it long term, but if you are, wanting to make sure that it doesn't come back, I would include it like, on a regular, once or twice a week. Just take a cup of it to kind of keep your body in check. And the last one is going to be cinnamon. And we use the cinnamon to fight the inflammation, because of course, when you get a yeast infection or bacterial vaginosis, the itching and all of that, it becomes inflamed in those areas. And the cinnamon is designed to fight the inflammation as well as prevent the overgrowth of the bacteria or the candida in the process. So okay, so okay, did it cut off? Okay, I think we're still here. Alrighty. Okay, so so far I've only seen one question come through, and I think I answered it, but if you have any other questions, please drop them in here. I am going to try to answer everyone's questions. Like I said, there were several questions that we got regarding hormonal balancing, but just understanding that we're going to talk about each one of those issues, which is why I brought up the endocrine system. We have to make sure that we're keeping the thyroid healthy concerning our hormones. If the thyroid is off, it throws everything else off. And like I said, the pituitary gland is your master gland, and it does regulate everything else, but your thyroid and parathyroid play a major role when it comes to hormonal balancing and making sure that your pH is in check and things of that nature. And now tonight, like I said, it's going to be a shorter one. When we meet again, I'm going to do another video tomorrow around the same time, and we're going to kind of focus more so on fibroids, womb care, keeping your area healthy. We're going to also talk about PCO, the PCOS, PCOS, and later talk about infertility. And I think we'll also be touching on menopause. And there were a few ladies that have had some hysterectomy, and we'll kind of touch on that a little bit as well. So if nothing else, I'd like to thank everybody for joining. Cynthia, Nicole, Sharon. Oh, and Sharon, you gave me a lot of good information. So thank you for your help as well. Lynette, Jenna. So everyone who joined me tonight, thank you. And of course, you can always DM me if you have any additional questions or, think of some other topics to kind of, shoot my way. I'd appreciate it. And again, I'm willing to assist anyone that does need help. So, again, thank you for joining me, and have a great evening.